you, my friend Fabrizio Ciancio from the Italian Radio Florida, the Common Sense Radio, because I love the common sense. And sorry, we need to continue to talk about this beep COVID because not its end, and we need to know more. We need to have more information for save lives for us people, for us friends. Means we need to share this information, this interview, because it's very important for all. And today we are in connection with a very important structure, clinic that help many people. Hello, Mr. Klotz.
Hey Fabrizio, how are you doing? Good to see you again.
Me too, me too. It's incredible time this, but it's important, and I love what you do. And I want to start immediately because already we know what is the common sense, and all the people that listen us know the common sense. And means the first question is, what is your clinic specialized in?
So as you know, 3 years ago, I had long COVID. I did not recover from COVID. I was wheelchair bound. I was bed bound. I couldn't move. I had 24-hour pain. I had brain fog. I was a very severe client. I then found the therapy in Germany, where Dr. Jäger treated me. And now we built a clinic together with her here in Cyprus. And our clinic specializes on people that have long COVID, post-COVID, and post-vaccination injury. Basically, injuries that are coming from the spike protein of the SARS-CoV-2 virus, but also of other viruses and other bacteria, like ME/CFS, Lyme disease, and also diseases where blood disorders are at the core, like fibromyalgia, Sjogren's, and other illnesses, chronic illnesses.
In the mainstream media, long COVID and post-vaccination syndrome are often described as untreatable and mysterious. I'm sorry for my pronunciation, of course. Why is your clinic able to treat it?
Well, it's true. In the mainstream media, very often, and also the public opinion, when you Google it, it will say it's mysterious, it's untreatable. And why is that? It's very simple. History repeats. 20, 30 years ago, we had the same with the HIV virus, if you remember. The people who had HIV, they didn't get proper help and treatment the first 10, 20 years. And that's a normal thing in systems. Now, the medical system needs time to learn, adjust, and absorb the new research. So why do we treat it now? It's different because I was a patient myself, and because we were purpose-built. We built this clinic specifically for helping people with these problems. So we're not only relying on the science that will be there in 10, 20 years, because science is very accurate, but at the same time, it's very slow. That's the nature of science. Clinical experience, which is what we learn every day in the clinic, from patients, with patients, all the doctors, the personnel in the clinic, that clinical experience is much faster. You can get a lot of clinical experience by simple pattern recognition and by other mechanisms within a year or two. Of course, it's not as accurate as science, but I always say it doesn't help the patients if we treat them in 20 years with a 100% method. It's better to treat them now with a 70% method. And that's why we can treat long COVID and post-vac now. It really differs from the success rate, where we are at around 80% success. And if I mean success, I say significant improvement. So some people, from being bedbound in a dark room, no noise, no light possible, they will go back to a part-time work job. They can walk again. They can have a family life. Some people will go all the way. They can do sports again. Every person is different.
Yeah, it's true. And why did you build this clinic, and why did you make in Cyprus?
That's a very good question. So usually if there is a new clinic, a hospital built, there is investors and it's a business. And usually it's built because they see there is a space, a slot in the market, and they see a business potential. For us, it was very different. We didn't know anything about the medical area. We were patients ourselves, and we saw there is no help for other people. So from our old job, I was basically in the digital industry, payment industry. I helped people and companies to make fast and easy payments. That was what I did. I was self-employed with a second partner. So I had no experience in the medical industry. But then once that I got healthy again, and it took me over a year to find the right treatment, help apheresis, combination therapy. Once I was healthy, I was like, okay, I cannot go back to my old job knowing what I know now. Other people will need help too. So basically, then we started looking, where can we build a clinic where people speak English, where the price level is very low, where they have direct access with a lot of flights, where we have a good and professional private medical sector, because in the public sector, it is too slow, so it needs to be private. And where do we have actually all of the benefits in one place? Where can we get hyperbaric oxygen, cryotherapy, help apheresis, intravenous treatments, antiviral therapies, anticoagulation therapies, IVIG, MABS therapies, all of this. And we looked at about 10 European countries: Malta, Bulgaria, Romania, Czech Republic, Germany, Austria, Switzerland. And Cyprus was the one who ticked all the boxes. And because it's our own history and it's a personal story, that's why we built the clinic. And after going through everything, we built it in Cyprus.
Fantastic. What is your advice to someone suffering from the long COVID and post-vaccination syndrome, not finding help in his country?
Well, it's very sad that we have to discuss this, but it's true. So many people don't find help in their own country. Our patients, they come from Australia, Canada, US, Singapore, Japan, Norway, the whole Scandinavian area, Switzerland, Germany, Austria. It's been now over 50 countries that our patients come here. And they all report the same. I don't find help at home. And why don't they find help? Well, it's a very simple thing. In the beginning, I thought maybe the doctors and the system don't want to help. That's not the truth. They're just bound by the system, the rules, the regulations, and they don't have the ability and the knowledge to help so quickly. So usually what happens is, if a doctor doesn't understand an illness, he tries to make a diagnosis that is as proximate to something that he knows. Unfortunately, that diagnosis is not always right. So as long as you don't have an expert doctor who only treats people with long COVID or post-vaccination syndrome, it is really hard for the doctors. My own uncle is a doctor. And until this day, despite having seen my mother, despite having seen me, he still is not in tune with the subject. And he still says long COVID is not treatable. It's hard to treat. Because don't forget, doctors don't really like to admit if they don't know something. And it's very hard to break down their belief system. So everything they have ever learned the last 20, 30 years, their whole study, their whole practicing, suddenly gets questioned because a new virus comes along and we don't find treatments for everybody. Then a group of scientists and doctors come and says, hey, listen, we have already 3-4 studies out. Look, this works. And it's interesting. In medicine, it's always the same way. It's always 3 phases. Phase number 1, they ridiculize it, they laugh about it. Phase number 2, they attack it with all the force they have. Phase number 3, they go and they say, well, I was one of the first supporters. I always knew this worked. So now we're between phase 2 and 3. The science is backing us up. The medical systems, they will still need another 5 to 10 years, actually, right?
You're right.
So my advice to people who face this situation is, first of all, we know what this illness is. It's a problem with the blood vessels. It's a vasculitis, to be very detailed, endothelitis. The skin inside of the blood vessels is really affected by it. So these small little fibrin aggregates, so-called microclots, And this is not a theory. This has been replicated, reviewed, peer-reviewed in South Africa, in Germany, in America. So we have seen these microclots, they block the microcapillaries, and then they cause a lack of oxygen and a lack of nutrition on the cellular level. And that also causes, of course, autoantibodies downstream. It causes a lack. There's a lot of systemic and local inflammation as well. So you really need to approach that. How can you do it at home if you don't have access to a clinic who has the machines? Well, there is 3 ways. First, the natural way. It works, but it's of course difficult. Try to get fibrinolytics, nattokinase, serrapeptase, maybe mix it with a baby aspirin, but of course you should always search a doctor that knows what he's doing, because doing it on your own, it can be dangerous. You can start bleeding. The second thing is try to find a doctor who offers triple anticoagulation. Now there's also risks and dangers involved there, so you really need to find a doctor who knows what he's doing, because taking 3 anticoagulation medications at the same time, there is also dangers to it. And the problem is very often when people stop the medication, the symptoms come back. So that's why if you have the ability to travel to one of the clinics. There's about 20 clinics, Cyprus, Switzerland, Germany, who offer health apheresis and combination therapy. Try to get all of that causes the illness out of your blood, combine it with the other treatments that fix the rest, endothelium, the mitochondrial damage, and we're not pretending we know 100% about the illness. I think we are currently at about 60-70%. But knowing that 60-70% allows us to create great clinical treatments, and they really bring the people very high up the ladder. Of course, in 10-20 years, we will know more about it. So, eat well, sleep well, eat clean, eat healthy, drink 3-4 liters of water every day, try to take anti-inflammatory supplements, NAC augmented, others, supplements that bind to the spike protein, of course. And of course, if you can, find a doctor who understands the hypercoagulation, the hyperinflammation, and then start treating it. Very often, supplements and medication will make you a little bit better. So that's what you can do on your own, you know.
Yeah, correct. Okay, thank you. It's very, very good advice for the people. Yes. Okay, and the last question, because as time is limited. What can be done against this?
This program is sponsored by a product that will surprise you. Augmented NAC is the innovative high-tech dietary supplement composed of high-purity N-acetylcysteine, processed during production in order to optimize its electromagnetic expression by enhancing its reducing antioxidant capabilities. Sure, you got it right, it's not a normal NAC. Here's a quantum technology. Laboratory analyses have shown the superiority of augmented NAC from 7 to 40 times better. Buy it at www.postcovid.com and feel full of energy again like you used to.
So you are right. And we already know why people that suffer from long COVID and post-vaccination syndrome have a very strong tendency to suffer from depression, anxiety, sometimes even paranoia. They're living in a very dark place. They're in a bed. They can't move very often. They're sensitive to light. They're sensitive to sound. They have a very short temper, a very short fuse. There's a lot of anger and aggression in them. But it's not the person. It's not the character. There is studies, and we understand very well what the problem is. The lack of serotonin and the fluctuating cortisol, especially the very low cortisol in the morning, will turn every human into a person that is basically in the state of somebody who's just about to go to war or to kill somebody. So there's a lot of aggression inside of you. And of course, negativity. Now, if you're inside of one of these groups, I discussed this with another patient from Australia, and he gave me some very good insights. He said, everything good comes with a bad. Now, inside of these groups, you can find the link to a treatment that works. You can find a good tip. Try to go to this doctor. Take that advice, but try to distance yourself from the negative thing, because there is a saying, misery loves company, right? And in many of these social media groups, we see that the people who are the administrators, they have been ill for 3-4 years. They have lost hope. They don't believe that they get better anymore. So it's just human that they block everything positive and they push the negative things. So they're going into a negativity spiral.
Yeah.
So what I tell people, try to find information, but don't stay on the mobile phone 24 hours in these groups, because it's very paradox. You're looking for a self-help group to help you. But what very often happens, it does the opposite. It makes you feel more negative. It makes you lose hope faster. Get the good bits, leave the bad bits. If you're not in the group, if you're on your own, you left the mobile away, don't forget, everything that happens to you is not you as a person, it's not you as a character. It's biochemically induced. We understand this very well. And when you come for treatment, we can see how this leaves the person, how the anxiety slowly goes away, how the color comes back to their top layer of the skin, how the blue lips fade away, how their eyes change again. It is amazing. We always thought this must be neurological, this must be psychological, maybe even. What we have learned is most likely, because nerves, the brain, they need oxygen, they need nutrition. Most likely this is very much interlinked to the hypercoagulation problem, meaning you don't get enough blood supply in the small blood vessels. They cause a lot of this, if not all of it, right? In 10, 20 years, we will be able to tell you exactly. But right now, what we know is already a lot. So, are these groups good for you? Yes. But in small dosages. Get the good things from them. Get the good advice. Distance yourself from the negativity. And never forget, the way how you feel when you suffer from long COVID and post-vac is not you as a character. It is biochemically. And why do we know that this exists? Well, first of all, every patient that comes, we see this is a thing. And about 75%, believe it or not, of the patients during long COVID or post-vaccination, they end their relations. Their partner, their marriage, sometimes the family.
Yeah.
Very, very often, they really go on their own. It's very sad to see that, because don't forget, if you have long COVID, if you have post-vaccination injury, to the outside, you don't look like a cancer patient. You don't lose all your hair usually. Your fingers don't burst. The chemotherapy doesn't mark you. To the outside, the 1 hour a day that you can hold yourself up and talk normal without the fatigue, without the post-exertional malaise, you look like a healthy person. When you come to the doctor, you take all the energy, all the adrenaline, and you try to pretend to be as good as possible. Now, what the doctor doesn't see, after that, for 20 hours, or even for 2-3 days, you crash, you're in the bed, and you cannot do anything anymore. This is why these illnesses are so cruel and so invisible, you know? And this is why it takes such a long time for the medical establishment to accept it, to design treatments for it, to endorse it. But thanks God, just a few days ago, there came a big study out of Switzerland and another big study out of Yale. This is not somebody. And they demonstrate that biochemically, you can now prove if a person has long COVID or not. They differ biomedically. Of course, it's very complicated research that you need to do. You cannot just go to a normal laboratory, but it is now possible to clearly say, oh, there is biochemically something wrong with that person. So slowly, slowly, things are moving. They know long COVID is real. They know it's biochemically induced. It's not a mental issue, because that's what a lot of doctors and a lot of people say. Well, you're just too weak. Take an aspirin. Go back to your couch. It's all in your head. This is my message to you and to the world. No, it is not. No, no, and no again. It is not. It is not a psychological issue. Yes, if you're ill for 2-3 years, down the line, it can psychologically affect you. I fully agree. That's nuances. But nobody wakes up one day and goes, I think I'm better off if I think myself ill. That is not a thing. Never has and never will be.
Thank you, because this is very advice, very important. Yes, I think the people need to think in positive and look the positive way, not the negative that the social media continues to tell. Solution, I interview many doctors. Many doctors have a very good solution, different because it can be different type of body or type of culture, of course, but the solution is available for all. Is only need to find the correct doctor that have the correct approach, like you, Miss. Thank you very much for your advice, and please share this interview. We need to give more information to the people, give hope. Not is impossible. Many people stay very well with many different type of care, and of course the water is fun. I drink 4 liters a day because I'm bigger. Means
I can absolutely recommend that. Don't forget, the water you drink goes into your blood vessels as well. So if you get 1 liter of NaCl saline intravenously, well, you can as well drink 4 liters. It almost does the same similar effect.
Yeah, the doctor tell me this quantity. Always follow the suggestion of the doctor, that people that have knowledge. Don't do yourself, don't read something, because the body not is all the same. Means the tips need be taken with care, studying your specific case, right?
Absolutely.
Yes. Okay.
And that is the hard part, as you said. Find the right doctors. But there is great doctors out there. There is in the US, Dr. Jordan Vaughan. There is Dr. Stuart Smith from RTHM. There is Dr. Minya in Scotland. There is Dr. Jäger in Germany. There is our Dr. Pavlik in Cyprus. There is the FLCC group, Dr. Pierre Corey. There is many great doctors out there. And they get more and more now, you know?
Yes. Okay, thank you for today, and can be we see in the future foresee the different stuff that is important to know. Thank you very much for your time.
I'm always happy to give you an update, because every 2-3 months, the medical teams, the researchers, they find new information, and I'm always happy to share that with you.
Perfect. Thank you very much, and
thank you very much, and let's see you soon. Thank you, Fabrizio.
Bye.